You know, accreditation provides education, validation, benchmarking for hospitals. It helps them understand what best practices are for treating the high risk to the low risk patients that could have an acute coronary syndrome. It provides the tools necessary to achieve those best practices, and then it provides external validation if they've achieved those best practices. It also gives them the opportunity to benchmark with similar institutions around the country, knowing that they're in a pool of about 1,000 hospitals nationally.
So by doing chest pain center, system-wide chest pain center accreditation, it shows our community that we are committed to taking the best care of our patients and our families. We are up to date on all new cardiac practices that come about because the society is up to date. And when they hear something, they pass it right down to us. It also allows those silos that tend to be built up around community partners, EMS, our primary care doctors, cardiologists, to be broken down basically. With EMS, in the Atlanta area, we have so many different EMS agencies, and so to be able to say that we have System Chest Pain Center accreditation, that also says that we've been working with all of those EMS agencies, and they support us and we support them.
So when we talk with hospitals and they're asking us about the type of benefits they can anticipate or should be looking to measure as they pursue accreditation, the top 4 that come to mind, and there's many more beyond this: lower mortality rates, lower length of stay, which helps hospitals reduce their cost, increase their throughput, so it has an added benefit of perhaps increasing income as well, lower readmission rates, so that has a significant financial impact on hospital performance. And then finally, increasing volumes through the emergency department. So not only does accreditation improve patient care, but it impacts financial performance, both with cost savings and revenue potential.
I was the chief medical officer for a number of years with the St. David's system in Austin, and we were one of the first hospital systems to get accredited for chest pain. And it was a transforming event for my organization. You know, in the past, quality was assumed, and we had a good name, we had a good brand, we had great cardiologists, but one of the things that we learned through our processes of accreditation, and we've continued on to this day, is that it requires us now to look at our data, to collect data. So not only can we say we're great, we can show it. And I think nowadays, in this era of transparency, we're going to be more and more forced to show our data. It's not just good enough to advertise and say you're the best. You need to prove it.
Going through the accreditation process allowed us to improve our transitional care, particularly from the ED setting to the outpatient setting. As part of our efforts, our AFib efforts, we initiated an AFib protocol in the ED setting. And those patients that were seen in the ED, they had either same day or next day follow-up within the center, and we were able to then address longer term needs for that patient.
But along the way, this process grows and grows and grows and grows, and you get a taste of it, and then you see what your potential is, and the society does that for you. It shows you the potential. Every cycle, there's new potential. I'm excited about the next cycle because the emphasis is on community, which is desperately needed. I mean, desperately needed. You look at some statistics that when I was writing my thesis, roughly 85-90% of people will recognize chest pain, crushing chest pain, as a symptom of a heart attack. But as that symptomology changes a bit, that percentage of recognition just goes down, 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 and down. And so I'm very, very excited about reaching out to the community and working with the community on recognizing, preventing, and then if God forbid it happens, recognizing and then responding to
Factors that would prompt a facility to get accredited through the Society of Cardiovascular Patient Care, there's a lot of them. I think the most important one is that deep down you have in your mission that you're going to be doing the right thing for the patient. And if that's the case, then everything that drives that becomes an obvious choice. And that's the first reason and you know, one of the most important ones. There are other reasons after that. You know, there's the financial aspect that when you're good at something, you're efficient at it, and you're efficient at it, then your ability to stay in business is better. And there's some other reasons to become accredited. One is you can tell the neighborhood, the public, your marketplace that you're accredited. And that does have cachet. You know, people do get it, that when you've been trained in something, you're better at it. And I think the last reason is someday you might be a patient. And where would you want to go?